There's one thing most people can't stand as they get older, it's a loose neck. So, the way the whole process would start is I would see you in the office, and we'd of course have a consultation. We would talk about your desires, your goals. We would talk about the concept of staying in an office setting, trying to avoid operating rooms, trying to keep things simple, keep it less expensive, and of course keep it safe. And keeping it safe is always number one, and all those things can be done with this procedure. So we'll talk about your goals, we'll talk about what bothers you the most. We'll talk about eyes and eyebrows and Botox and Juvederm and all those things, but we'll focus on the lower face, the jowls, and the neck. So we'll review your medical history, look at your medications, your allergies, previous surgeries, previous scars, and you know, if it's just not matching up for a safe, well-done procedure, then perhaps it's not for you. Perhaps it needs to be done in the operating room. Perhaps we need to do some more workup or keep it even more simple with basically just injections. So let's assume that you're a good candidate. You've got jowl formation, you have your loose skin in the neck, and the deep folds, and you want something definitive, natural, and safe. So, and here we go again with the local anesthesia office facelift. And what's interesting about this procedure is that it's not a gimmicky thread lift, a non-surgical, magical lunchtime procedure. It's real surgery, real facelift, just as they would do in the operating room, but in a different setting. And this setting is very popular for many patients because they may be afraid of going to sleep with a breathing tube. They're afraid of hospitals. They don't want all the medications going into their body for the anesthesia, the nausea, vomiting, the foggy head, all the rigmarole of the hospital. So most of that can be cut out, and we can stick to the basics, which is local anesthesia. Local anesthesia is an amazing thing, and you can provide anesthesia to the face with local anesthesia that makes it completely numb and absolutely amazingly simple to do as you're actually watching TV and talking to me and my assistant.